Thank you, Mr. Speaker. Mr. Speaker, my question is for the Premier. On March 10th of last year, in closing third reading of Bill number 242, Protecting Access to Reproductive Health Care Act, my bill, I raised the issue of differential access to IUDs. An IUD costs $400, and while this may be covered by Family Pharmacare or by private insurance, it is not covered by MSI. The former Premier at that time committed to go back and look at whether government could address this gap right on the floor of this chamber. But unfortunately, in response to a follow-up letter we wrote in October, the then Minister of Health suggested that no action had been taken and none was planned. Mr. Speaker, will the Premier commit to adding IUDs to the list of services covered by MSI?
The Honourable Premier.
Thank you, Mr. Speaker, and I don't have background information on this important issue, but I can assure the member opposite that I'll engage discussions to get caught up to speed and where that discussion left off with the Minister of Health. Thank you.
The Honourable Member for Dartmouth South.
I thank the Premier for that response. Mr. Speaker, contraceptives are basic preventative health care that should be free and easy to obtain. Many organizations have advocated for access to free contraception, including the Canadian Medical Association, the Canadian Pediatric Society, and the Society of Obstetricians and Gynecologists of Canada. MSI does cover more expensive services like hysterectomy, vasectomy, tubal ligation, and surgical abortion, some of which can be avoided with this compassionate, low-cost intervention in preventative women's health care. But not contraceptives. Those aren't covered, Mr. Premier. So, Mr. Speaker, will the Premier agree to provide, I apologize for addressing the member directly, Mr. Speaker, will the Premier agree to provide free coverage for prescription and emergency contraceptives for all Nova Scotians?
The Honourable Premier.
Thank you, Mr. Speaker, and I want to thank the member for bringing the issue to the floor of the legislature, a very important issue that we'll definitely go back and have that discussion to see where the IUD discussion was left off previous to me, as well as there's other issues I know along the lines of contraceptive that we'll look at as well. Thank you, Mr. Speaker.